Shoulder pain is really common. It starts at the tip of the shoulder, can proceed to bursitis, rotator cuff tendinopathy, and even a tear of a rotator cuff. It can be really sore. People who are office workers, tradies who have to climb and lift things above their heads, cleaners can get shoulder issues. If you have shoulder pain, here are 4 tips for you to follow with a bonus 5th tip at the end of the video. So here's my friend Jimmy. He's going to help us to explain shoulder pain. So you have your clavicle or your collarbone and your shoulder blade behind, just there. Where they meet, right underneath there, you have your humerus or your arm bone. You have a bursa, which is a fluid-filled sac, which helps to lubricate the joint. And also you have the meeting point of many tendons. Now, if your shoulder's quite stiff in a few of the movements I'm going to get you to self-evaluate, you could be putting excessive pressure on this very important region, and it can cause bursitis, inflammation, and if you leave it long enough, the tendons can start to tear a little bit, and if you leave it longer enough, it can have a full tear, which sometimes requires surgery. So let's get into the movements that I want you to self-evaluate and see if you can improve your flexibility in your shoulder. If you're liking our content, please like, share, and subscribe. All right, guys, so the first movement we're going to use for self-evaluation is shoulder flexion. Can you get your elbow behind your ear on both sides? Now, you'll be surprised how many people cannot do this. Instead of going all the way back, they're kind of here, which isn't quite full 180 degrees. And what that means is when you go to lift something into an overhead locker, instead of being able to go all the way up, you've got to kind of go slightly forwards. And that does put more pressure on your shoulder. And some shoulder muscles are used more than they need to be. And you start developing inflammation and bursitis and small little tears. So it is important to get your shoulders right behind your ears. Get a full 180 degrees right up to the sky. The second movement is, can you get your hand behind your back? Can you scratch your back? Can you put on your bra strap? There's a few things you might notice. You might be a little stiff on the side that you're not so good at. So that's because your dominant hand is the one that's not so good at it, because your hand's on the mouse holding your phone. And so your chest and your pecs become quite tight, and you might find that you can't reach as high with that right side as the left side. It's uncomfortable, you feel a bit of pain. In fact, your chest and the external rotator muscles of your shoulder, the important ones, are often lengthened. And when you do it all of a sudden, when you're quite bad at it, that's when you can injure your shoulder again, causing all those inflammation, the tendinopathy. So the area you're wanting to reach for is T4, 5, 6, which are some of the bones between your shoulder blades. You want both sides to be around this region. If you're a bit lower, you're probably too tight in your chest region, and you need to work on getting your chest more flexible and getting your hand being able to reach between your shoulder blades. Your dominant side might not reach quite as high, but my left hand might reach up to there, and that's quite common to see. But if you're lower than that, you really do need to work on that, because when you do have to put your hand behind your back, you may actually pull and injure or hurt something. For some people, they've been in front of a computer typing all day, and then they reach behind their back all of a sudden to scratch their back quickly, and then they hurt their shoulder. So that's the second movement I want you to get better at. The third movement I want you to master is getting your whole arm right against the wall at 90 degrees. So not down here, up there, 90 degrees. Arm planted against the wall, so your biceps, your shoulder, everything pressing against the wall, and turn into your room. You should be able to turn a full 90 degrees, opening your chest, opening your shoulder, stretching your biceps. You want to be able to do this to have full range of motion in your shoulder to counter all the times you're sitting in a forwards and upwards position. So get good at this, because this often helps with shoulder pain, but it even can help your neck and your upper back as well. And you're kind of stuck to the wall, so you're going to have to practice opening away from the wall. Maybe you have to start with this hand slightly lower down. I've seen people having to start down here because they're so aggravated, they're so sore in the shoulder. You start from somewhere, but eventually you want to be able to do that. Turn the whole body away into the room. And that often means you're up taller, you're up straighter, you feel like your chest can open. You can take deep breaths, you can do bigger hits with a racket, for example. It opens up your chest It helps throwers getting full range of motion and full throw. So it's a really good, simple test to see how well does your chest expand and how well do you get into horizontal abduction behind your back as well. It also is kind of like this as well. So if you can do one arm, that on your left and that on your right, then you should find no issue with getting your elbows right behind your chest and being able to lift all the way up, taking some nice breaths in and out. That's a really great feeling stretch at the end of a working day. So the fourth movement I want you to get better at is external rotation. So if I'm facing north, arms go east and west, full 90 degrees. If I'm facing this way, elbows by my side, this hand is pointing straight to the camera. Elbows have to be strictly by your side when you do this. You can't do that and cheat and go further out. So elbows strictly by your side, get a full 90 degrees. Now this is kind of similar to that. So that's why it's important, because if you lift things above your head into the overhead locker on a plane trip, if you do not have full external rotation here and there, you're likely going to put extra strain on your muscles, causing bursitis, inflammation, those small little tears which could develop into bigger tears and take months to rehab. So that's why that is really important. Again, you'll be surprised how many people have like this. They're really strong, really powerful, or you're doing a lot of chest work and not enough of opening work, and therefore you can't go past there. You need to practice that. In fact, you want to be able to go past 90 degrees. Get past the vertical is even better. Now again, if you can only go from here to there, which is surprisingly common, your external rotators, those rotator cuff muscles in your shoulder blade, are probably not working to their full capacity, and therefore they may not be as strong, as flexible, as resilient as you like. That's where you get little tears from not having enough rotation, range of motion, and strength at the end of a range. The last movement for self-evaluation is, can you get your elbow right behind your skull, right behind your head? You should be able to hold on to it with your other hand. That hand is touching the middle of my back, and then I'm able to tip all the way to the side. So I should be able to get about a 30-degree angle from vertical, and you should feel like a really nice stretch in your lats here. Now your lats attached from your lower back, your hip, all the way into your shoulder blade and even into your arm. So it influences a lot of things. It influences how well your shoulder can move up and backwards, and also out to the side as well. It's one of many muscles that can affect that as well. Getting this looser is actually to your advantage if you have shoulder pain. Now you'll be surprised how many people can't even get their elbow behind their head. They'll be out there like that. So you've got to start with what you've got, but eventually get your elbow behind your head and then really stretch it. You'll feel a wonderful stretch. You hold it for about 30 seconds. Nice big stretch down there. Deep breaths in and out. You can even turn a little bit outwards or rotate your body to the side you're stretching to feel a bigger stretch. After you've done that, you should find that you've got more range of motion in shoulder flexion and maybe even shoulder external rotations. Your chest should feel more free. You should feel more able to breathe, which is also important for your shoulder and your upper back and even neck pain. And you might find it helps your lower back pain and your neck and shoulders too. It's good for many things. So there you go, guys. You've got 5 pretty important shoulder movements. They tell you a lot about your shoulder. If you're not really up to standard with some of them, try to get to the standards I've suggested, and it's more than likely your shoulder is going to feel better. On top of that, we do want to get your shoulders stronger as well, which I'll show you in the next video. Work on your flexibility. It's always a good idea to get your shoulders more flexible and stronger if you want to get rid of your bursitis, inflammation, pain in general, those little tears, and prevent yourself from getting anything serious in your shoulder. So get strong, get flexible. That's a principle for most things in physio. So now you know how to get flexible. I'll show you how to get stronger in the next video. Like, follow, and subscribe. Thanks a lot, guys.